All right, so are you ready for your procedure? Okay, so this is an insomnia extraction. I will be giving you a mild sedative sublingually. It should help you relax. This is a procedure that can be completed whether you're awake or asleep though. So if at any point you find yourself getting sleepy, you want to doze off, that's perfectly fine. Go right ahead. I am going to be going through your ears to do the extraction. Okay, we'll start with initial check with my otoscope. Then there's going to be a steam treatment. Then I'm going to go in with a special tool, a modified otoscope, and I will start doing a round of extractions on both sides. Okay, then we'll go through the whole process one more time. We will finish up with a final check, and then I'll send you on your way, and you can come back another day for your post-procedural evaluation. Okay? So, this is going to require me to touch your ears quite a lot. I may also need to periodically touch your head, your face, just to stabilize it as I'm going into your ears. Is that going to be okay? Alright, great. It shouldn't be uncomfortable at all. It shouldn't hurt. It should just be relaxing. But if at any point anything does feel uncomfortable, please let me know and we'll pause the session. Okay? Alright, so let's go ahead and get started. I'm gonna place my over here and just a moment. I'm gonna get some hand sanitizer and put on my gloves. Now, you probably already know this, but full insomnia extraction is something that's usually done in stages. We should be able to remove a lot of it during your first initial session, but you'll see the best results over multiple initial sessions, and then you'll want to do occasional maintenance sessions later on. Alright? Okay. So I'm going to start off with your initial inspection, then we'll do the steam treatment, the extraction, and to start, let me grab your little dose of that sedative. It's very mild, very safe, flavorless. Okay, so I'm going to have you open your mouth, tilt your head back a little bit. I'm going to pour just a third of a vial here into your mouth. If you could have it rest under your tongue for a few moments and then swallow it. Okay, so go ahead, tilt your head back, open your mouth, lift your tongue up. I'm just going to put it right there. Good. Okay, you can close your mouth, but try and hold it under your tongue there for a moment. Put this away. Okay. Alright, can you try and swish it around your mouth a little bit? Good. Go ahead and swallow it. Great. Alright, perfect. Again, it's very mild. You shouldn't be like feeling anything too wacky. You should just notice your body gradually relaxing as we move forward. Okay? Great. So, I've got my otoscope right here. I'm gonna start on this side. Carefully examine. Move on to the other side. Examine. I'll take some notes and then we'll move ahead. So, you're gonna feel the tip of the otoscope entering your ear right here. Good. Okay. So I'm just taking an initial look around. Get a sense of the overall health of the ear canal and the membrane, and it is looking really good. Okay. Gonna spend a little time doing a slightly more thorough examination. Looking for any redness, swelling, any abrasions, lumps, bumps, anything like that. And I'm really happy with what I'm seeing. It looks good. Okay, I'm going to go a little deeper and take a look at the membrane. Okay, let's see. Everything's looking really good here too. No signs of fluid buildup or infection, nothing like that. Good. Okay. I'm gonna go ahead and remove the otoscope. Same thing, other side. Alright. Otoscope entering your ear right here. Okay, and once again, I'm gonna start with kind of a quick once over, just taking on the ear canal and the tympanic membrane, seeing if anything concerning catches my eye to start. And nope, we're looking pretty good. Okay. Backing up a little and taking a slightly more thorough look at the ear canal, checking for lumps, bumps, abrasions, any reason to be concerned with CERVIN or signs of infection, anything like that. And I'm not seeing anything. We're looking really healthy. That's good. Let's go in a little deeper. Take a look at that tympanic membrane. Okay. And once again, I'm really happy with what I'm seeing. It looks healthy. Not seeing anything to be concerned about. Right now, translucence, the structures behind the membrane. Look just how they should. And that's great to see. Okay. Alright. Gonna remove the otoscope. Alright, beautiful. Just a few quick notes. Left ear in. Check. Right ear in. Beautiful. Set this aside. Next, for the steam treatment, I'm going to be treating each ear with a damp, hot sponge. It's not hot enough that it's going to hurt at all, but the warm moisture from the sponge is going to be sort of like a steam treatment from your ear for your ears, and that's just going to help relax the ear canals. It's going to soften the filaments of the insomnia so they'll be easier to remove, okay? So I'm going to go ahead and just going to stand behind you while I do this. We'll start on one side, then the other, and then we'll go ahead and do both sides, alright? Just a moment while I move around you. Alright, so just going to grab these lovely warm sponges from over here and put them right here, okay? So once again, these are heated, but they're heated to a very specific temperature that it should not be uncomfortable. I'm going to start off by pressing one to your left ear over here for a few moments. Then we'll do the right. And then we'll do one more of each, and then we'll do both together. This is kind of off and on rhythm that we found works really well for steam cleaning the ears. Just gonna squeeze out some of the extra water real quick. There we go. Okay. As nice as the warmth feels, I don't want to send any water dripping down your neck here, okay? So, I'm going to place my hand on the right side of your head here just to kind of stabilize your head while I press this to your ear. And here we go. Just going to hold it there. 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I'm going to place that back in the warming device and grab the other sponge. Squeeze out some of that extra water. Okay. As I'm placing my hand on the left side of your head here to stabilize it, I'm going to press the sponge to your right ear. Right there. Okay. Once again, holding it to a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, let's remove that. Beautiful. I'm going to swap out those sponges again. I'm going to move back to the left side here with the sponge. It's going to be a little different than last time. Instead of holding it stationary, I'm going to be moving it around a little bit. Placing my hand on the right side here to stabilize. And here we go. Gently passing the sponge. Couple more times. Going to swap out the sponges and do the same on the right side. Okay. I'm going to feel my hand on the left side of your head, and once again, this is going to be with movement over the ear. Nice and slow. Couple more times. Okay, I'm gonna give this sponge a chance to get damp and warm again. I'm gonna grab the left ear sponge. We're gonna do one final pass, pressing both sponges to both of your ears at the same time, just holding them steady this time. Once again to a count of 10. Okay, I think this one's ready. So here we go, both sides. There we go. Okay. And once again, counting to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. There we go. Okay. Gonna go ahead and set these aside. We'll grab some fresh sponges for the next time we do this. Just a moment. Okay. Put them back over here. Good. Beautiful. Okay, now, just going to take a few more notes and then we'll move ahead. Okay. Alright, for the extraction that we're going to be doing in a moment, I have this specialized tool that's a lot like an otoscope. However, it has this long, tiny, thin little scoop. It's like a soft, flexible scoop. It passes through the otoscope and it allows me to gently remove the insomnia a little bit at a time, okay? It's very soft, very gentle. You might feel a slight tingling sensation. It's totally normal, okay? So, let's go ahead and get started with that. First on this side. Alright, so I've got the tool right here, and it's gonna feel a lot like the otoscope did, just with a little bit of scooping added. So here we go. You're gonna feel it entering your left ear. Okay, good. Let's get nice and deep into the ear. Good. Alright. Okay, so taking a look around, and wow, yeah, you've got a lot of insomnia in there, quite a lot of buildup. No wonder you've been having trouble sleeping. Okay. I'm going to start using the little extension on here to gently start removing some of that insomnia buildup. Okay. I'm gonna start right here. You're gonna feel a gentle scoop. Good. Alright. Now moving over just a little bit. I'm gonna scoop some out from here. Beautiful. Okay. Let's get one from back here. Good. Okay. And I definitely want to get that one, but I think I'm going to need to remove a couple others that are kind of blocking it first. So let's go up here and get this one. Good. Okay, and then back down here. Clear this one out of the way. Good. And let's go ahead and get that big one I had my eye on. Gonna feel a gentle scoop. Good. Good. Gonna get maybe 2 or 3 more for this round. They're coming out really easily, which is nice. Let's go ahead and get this one here. We're gonna scoop. Good. Yeah, sometimes they can be stubborn, but these are coming out really nicely. Okay, let's get this one here. I'm gonna scoop. Good. And let's get this over here. Good. Beautiful. Okay, I'm gonna go ahead and remove the tool from your ear. Beautiful. I was able to get a lot. Let's see if I can get as much on this side. Alright, so just the same as the other side. Got my tool here. You're going to feel it entering your ear canal right here. Okay. I'm hoping I can get at least as much on this side, if not a little more maybe. So, get all the way back there. And let's start over here. Just gonna scoop that out. Good. And let's go up over here and remove these two. I'm gonna get that one first. No, I think I need to get this one out before that one's gonna move. So let's go ahead and scoop that out. There we go. Okay. I'm gonna get back in there and see if I can get this one out this time. So. Right in there and beautiful. Yeah, that came out really easily. Okay. Let's get this one over here. It's just barely hanging on. I think it's ready to go, so I'm gonna scoop. Good. Okay. And let's shift over to the side. Got like 2 or 3 here, and I think can get all of them. So let's start down here and 1. Good. Okay, and over here 2. Beautiful. And finally, let's get in here and 3. Good. That's really nice. We've already cleared out a lot. Let's get back in here and see if I can get here. Scope. Nice. Okay. And I think for this round there's just one more. And then the other ones I'll come back to after you've had another steam treatment. I think that'll help loosen them up a little more. So let's just get this one and right here. Good. Alright. Great. That went really well. Just gonna notate a few things, check off a couple things here. We've got and the moderate be soon later. Okay. Now let's go ahead and do our secondary check with the otoscope. First on this side, then over here. Alright, here we go with the otoscope again. Entering your ear. And let's take a good look around. Once again, examining the health of the ear, checking for any signs of irritation or concern, anything like that. And we're looking really good. Check the condition of the ear as far as anything else we want to remove. See what kind of progress we made. And it looks beautiful. I think we're in really good shape here. Okay, let's go ahead and remove the otoscope. Okay, looking good. And here we go with the otoscope again in your ear right here. Okay, just beautiful. I'm really happy with what I'm seeing here. Made a lot of progress already. The ear's looking really happy and healthy. Just responding really nicely to the extraction process. Not seeing any signs for concern. Everything looks good. Okay, let's go ahead and remove the otoscope. Beautiful. A few more notes. Then we're going to do another round of all those things. The complete secondary left ear and factory. Okay, and right ear. And 1, Beautiful. Okay. We're going to do another steam treatment on each side. Get behind you again. Okay, let's grab some fresh, hot sponges. Here we go. Gonna place them down right here. Okay, this is gonna be the same as the first time. I'll go left and right, just steady, then left and right with some movement, and then we'll do both at the same time. So. Again, I'm going to be placing my hand on the right side of your head to stabilize it here. Okay, just pressing it there, and you're going to feel that sponge on your left ear. Okay. Let's count down this time from 10. 10. 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Swap out that sponge. Same thing, opposite side. Placing my hand on the left side and 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Let's get back to the left side. Hand on the right side of your head. And again, this time it's going to be with a little movement over the ear. Hand on the left side of your head here, and here we go. Both ears this time. Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Beautiful. All right, let's put those away. Good. I'm gonna go ahead in and do another round of extractions, okay? Again, we'll start on this side, and then we'll go back over to this side. We got so much the first time, I think we're going to be able to make even more progress. All right? Great. So, here we go. I think you know the drill now. You're going to feel it entering your ear right here. There we go. All right, so I don't think we're going to be removing quite as much as the first round. We already cleared out so much. But I see a few that are pretty deeply embedded. So I think that's going to be a real big help to get those out. Which ones do I want to get? Okay, I think there's 4 or 5 that I'm really hoping. Okay, so starting here, we're gonna scoop. Good. That came out even more easily than I'd hoped. Okay, let's do this one. We're gonna scoop. Excellent. Okay. That steam cleaning definitely helped loosen them up quite a bit. I'm gonna go in a little bit deeper. See if I can get this one here. And actually, I think I'm gonna have better luck if I remove this one first. It's just blocking it just a little bit, so I'm gonna get that. Good. Okay. Now I'm gonna get back in there and scoop. Good. Looking absolutely incredible in here, so let's push our luck and see if we can get one more way in the back here. Okay. Gonna angle this just right and gonna scoop. Good, I got it. Wow. Okay, removing the tool. Amazing. I'm so happy with how this is going. Let's go ahead and we're gonna get in there one more time here. Okay. Here we go. Alright. Yeah. Very similar to what I was seeing on the other side. We cleared a lot out, but we have quite a few that are really dug in there in the back. That steam should have made them pretty easy to access though, so let's start up here and scoop. Good. Okay. There's 2 over here on the anterior wall. Let's go ahead and get both of those. Get 1. Yes, there we go. And want to see if we can get at least one, maybe two more before we wrap up here. And let's see if I can get this one in the back here. I'm not sure if I'll be able to, but I'm gonna try, okay? This one looks like it's been camping out in there for a real long time. So let's say it's time for it to go, okay? I'm gonna get right in there and let me shift the angle just a little bit and good, I got it. Okay. Let's do one more. See one here along the posterior wall that it's not that big, but it's kind of flat and spread out, so it's covering a lot of area. I'm gonna kind of attack it from gonna get it from the bottom here to start. We're gonna get right in there and let's scoop that out and wonderful. I'm so happy I was able to get that one. Okay, I'm gonna go ahead and remove this from your ear. Beautiful. You're sitting so well for this, thank you. Okay, just gonna check a couple of things off. Cleared. More. Okay. So, just gonna do a final check on this side and then on this side. Write down a few quick notes about my findings, and then you're gonna be all set, okay? Alright. So, again with the otoscope, I'm gonna start over here. And I'm gonna place the otoscope in your ear again, right here. Let's make sure we do a nice, thorough check. Everything looks really beautiful, but I want to make absolutely sure nothing to adjust or treat before I send you out of here. And wow, it looks so good. Okay, checking the ear canals. So, are there any signs of irritation, swelling, anything like that? And no, looking really happy and healthy, just the way I like to see it. Looking even lovelier than when we started. Okay, let's take a look at that eardrum back there, and it looks really good. Just beautiful. Okay. Right, translucence. No sign of excessive fluid or anything like that. I'm not seeing any reason at all to be concerned that the treatment might have caused any irritation or anything like that. It's not really something that happens very often anyway, but you always like to make sure, so let's take one last look around. And it just looks really good. Okay. Gonna remove the otoscope. And finally, we're gonna do one final check on this side. Here we go with the otoscope. And gorgeous. Everything looks just great. Okay. Take a quick scan over everything to start, and then go back and do it a little more thoroughly, but I'm not seeing any reason for concern. Nothing but indications that the extraction was a huge success. This is a triumph, really. Alright, let's go through that a little more thoroughly, checking the ear canal. No redness, no redness, no swelling, no sign of anything that would concern me. And going a little deeper for that tympanic membrane back there. And that looks just beautiful too, okay. Really healthy. I think the insomnia extraction process just really agrees with you, okay? And that's it. I'm happy, okay? Gonna remove the otoscope. Beautiful. I want to congratulate myself for this being one of the best treatments I think I've ever done. But I think it's mostly you because you sat so well for it. Thank you. Check the left quadrant was. Okay, and on this side we have 1, 2, 1. Okay, I'm just going to sign off. And it is a clock. Alright, well, it was an absolute pleasure working with you today. Thank you so much for participating in our study. I hope it works really well for you. I'm looking forward to seeing you at your follow-up appointment. You can go ahead and schedule that on your way out. But for now, thank you so much, and I hope I'll see you again real soon. I'm so pleased to have you back for phase 2 of our otoscope endurance protocol. How are you feeling? Okay, so phase 2, it's going to be a very similar format to phase 1, but we're going to go a little longer this time. Do you think you're up for that? Okay, so as a reminder, I'll just start off on one side, examine your ear very thoroughly. I'll move over to the other side, do the same thing over here, and then it's just going to be the same thing, back and forth, over and over, and we'll see if you can make it all the way to the end, alright? Okay, great. So, if you can go ahead, get yourself comfortable. This is going to take a little while. I will grab my gloves, I'll grab my otoscope, and then we'll go ahead and get started. Here we go with round 1. I'll start right over here. Alright, so in just a moment, you're going to feel the tip of the otoscope entering your ear canal right here.
and remove the otoscope.
Wonderful. It's just like riding a bicycle. You've totally got the hang of this. Over here.
Alright. Same thing, other side in just a moment. You're gonna feel the tip of the otoscope entering your ear, and here we go. Good on this side as well. Looking pretty clean. Looking pretty healthy. I'm not seeing anything that would cause concern. Not off the bat, anyway. One spot right here, and yeah, that looks good. Okay, going a little deeper in, and we've got another really good looking tympanic membrane here. Take a look at the perimeter edges, and that looks great. Looking at the membrane itself, it's looking really good. We'll do a more look next time around, but I am very happy with what I'm seeing. Okay, good. Gonna go ahead and remove the otoscope.
Beautiful. Okay, so I'm going to head back over here, back and forth, lots of the same. As a reminder, it's totally fine if you want to close your eyes, relax, even doze off a little bit. That's perfectly acceptable, okay? Great. So,
Okay, let's go in for a little bit more of a detailed look. I'm gonna get right back in here, and there we go. Okay, take a slightly more thorough look at the ear canal itself, really checking for any sense of irritation, any little abrasions or anything like that. from the side. Looks pretty old, I think. That's the biggest thing that we normally see that a lot of people have to be concerned about. Most people have, at least in ear infections when they're little. Infections when they're little, it's very common. Okay. Gonna remove the otoscope.
And
Okay. Let's get in there and gonna get right up to your ear and once again still looking really beautiful. It's a really happy, healthy looking ear canal. But we're gonna give it an extra thorough look just to be sure to kind of check for all the things that we did on the other side. We're just checking for this earwax that doesn't appear to be a problem, but we're gonna check the whole thing just to be sure to check all the grannies in here, and I think we're good. Not seeing any signs of infection or irritation, no obstruction, redness, anything like that. Gonna go a little deeper to the ear canal, to the tympanic membrane, and wow, yeah, it's looking really good. Beautiful. Okay, check all the same things. The light reflected, that kind of golf light is looking just right. And perfect level of translucence. Structures behind the membrane are looking good and healthy and in the right spot. Okay. Very happy with what I'm seeing here. It just looks really good. Okay. Makes me a little bit. That's something I see more often than I don't. Great. Okay. So, gonna go ahead and remove the otoscope.
okay.
Okay. Here we go again with the otoscope. in and I'm gonna go all the way to the back, and it's time to start with the tympanic membrane, and it's looking really good. I'm really pleased with what I'm seeing.
once again, you just did an incredible job. I'm going to sign off on you moving forward to phase 3. Okay. You're free to go ahead and head out. If you want to stop by the front desk, you can schedule your appointment for phase 3, and I'll see you then. Hello, thank you so much for participating in our clinical study today, and thank you especially for bringing your face with you. It's going to be very helpful. Just for verification purposes, may I have your name, please? All right, perfect. Now, this is part 1 of a 3-part procedure we're perfecting to improve muscle tone, and innervation of the facial muscles using a proprietary plumping serum. Okay. It's going to involve some palpating, some simple instructions. I'm going to be making some temporary marks on your face. Don't worry, I'll clean them off before you go. But mostly it's just going to involve a lot of measuring and writing it down, okay? And that's going to be my job. You can just sit there, all right? Okay. So, this part of the procedure is going to involve me touching your face quite a lot. It's also going to involve some touching of the neck and upper chest area. Is that going to be all right? Okay, good. So, if you could please get comfortable and just wait there for a minute or two, I'm going to go ahead and put on my gloves. I'm going to grab my supplies, and then we'll go ahead and get started. All right, thanks. All right, got everything I need. I'm just going to put on a little hand sanitizer. Gonna get my gloves on, and then we'll get started. Alright, so since what I'm doing is getting a bunch of baseline measurements for your face that we'll be using for comparison in a later phase of the clinical study, I would like to start out with a few simple techniques we use just to make sure that all your facial muscles are relaxed. If they're too tight or if there's too much tension in them, the measurements tend to be just a little bit off. It's not a huge deal, but we want to get it as close to exact as we can, okay? Yeah, a lot of people carry a surprising amount of tension in their facial muscles. So to begin with, I'm going to ask you, can you just look straight on my face? Okay. Yeah, I'm not seeing too much tension, but we're going to go ahead and could you just give me a big yawn? I want to loosen up those jaw muscles. Just nice big yawn. Okay, good. Just like that. Okay. You can close your mouth. Good. Can I have one more yawn? Nice big yawn. Good. Close your mouth. And we're going to do it one more time. Okay. Nice big yawn. Your biggest one yet. Good. Okay, great. Let me just check that off. And okay. Now, I'm going to give you a few more instructions, just simple exercises to do with your face. Can you go ahead and raise your eyebrows up for me as best you can? Good. Beautiful. Let me just take a look from the side here. Okay, and go ahead and lift them up again. up, down, up, down. Good. Okay. Can you go ahead and without moving your head, can you look to the left, please? Your left. Sorry. So look to the left. Look to the right. Good. Look up. And look down. Good. Now straight ahead at me. Good. Okay. Can you give me a frown, like a big, dramatic, you can stick your bottom lip out. Good. Now a great big smile. Big, big smile. Beautiful. You have a really nice smile. I love it. Okay. Now, can you open your mouth? Close your mouth. Now, can you just scrunch up your whole face? Just scrunch it up as tight as you can. Tight, 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 tight. And relax. Good. Now you just do some like random wiggles of your face. Just kind of loosen it up. Good. Okay, one more scrunch. Big, big scrunch. Tight scrunch. Good. And again, just sort of loosening it up. Good. All right, let me go ahead and check that off. Okay. Now, what I'm going to do next is I'm just going to do some gentle palpating of your face. Not too much pressure, just some gentle rubbing the forehead, the cheeks, the jaw, okay? Just going to start right here and just a little pressure. Gentle circles. Get your temples here. Good. Get the forehead. And go down your nose a little bit. Good. Get your cheeks, just some gentle circles, okay? Beautiful. I'm going to touch your chin and just kind of wiggle it a little bit. Good. I'm just going to do some gentle strokes down your jawline here. Good. Take a look. Okay. I'm going to go through all that one more time. Just a little on your forehead. Little circles. Gentle strokes. Temples. Good. Down your nose. Cheeks. Did you know you were going to be getting a facial massage today? It's really good for you in addition to helping the muscles relax. It keeps them healthy. It helps keep the lymph in your face moving. Okay. Jawline. Good. Chin, just gonna wiggle. Beautiful. All right. One more time. Can you just give me a great big yawn? Good. Look left. Look right. Look at me. Perfect. Yeah, I can see a little bit of a difference. It's subtle, but it's interesting. Some people come in and their face just, it's hard to explain. It's not fully active. But when you do those little exercises, you get that little massage, suddenly it's like, you're all in there. Okay. So, for the measurements that I'm going to be doing, let me find my... Okay. Here we go. So I've got my little workbook here. So I have all these measurements that I need to take. Got a clean page for you here. So what I'm going to be doing, using this as a reference, so I'm going to be taking this marker. I'm going to be placing some dots on your face, just so I know exactly which spot to measure to. Don't worry, this is very skin safe, it's easy to clean off, and when we're done here, I'll be very careful to thoroughly clean it all off, okay? Alright, so, if you would hold still, I'm just going to start dot here, and then we're going to go down to here, okay? I'm going to do one right here, and good. Don't have to get every single point. There are just a few that I want to go over here, right there, and here. Go down. Get right up here at the top of your forehead, right there, and then go down and do this spot on your nose right here. Okay. I can just follow the eye line on this nest. Same thing with the brows, but I do want to get right down here, and then down. Okay, other side, same thing. There. I'll still look at the got a couple right here. I'm just gonna do right there and there. Other side, same thing. Okay, I feel like we need one more set. Okay, right here. You just tilt your head up a tiny bit. I need to get this on your chin. Good. Alright, I think that's all I need for my little guidance dots. I'm going to go ahead and put this away. Alright, we're okay to go ahead and get started. This part's going to be pretty repetitive. Just do your best to relax and hang in there. If you get sleepy, some people find this relaxing. It's fine to close your eyes. Just hang in there, and all I'm going to be doing is I'm going to be referencing my different points here in the procedural workbook. I'm going to be measuring all the different points that we need. It's going to be a very simple process. I'll measure, and then I'll write it down. I'll measure, I'll write it down, and I have quite a few measurements I need to take. So, let's get started, will we? Okay, I'm going to get right up in here to start and measure from here to here. Get millimeters. That is and a half. Okay. Now, next I need to get this area right here. Let's line that up just right. Yeah. Let's check the other side, see if it's the same. Almost exactly, just teeny difference. I want to note that down. Okay, and was 4. Okay. Moving right along. To follow along the top of your eye here, so I'm just going to get in and just there. And that's nothing to worry about. Everyone's face is a little asymmetrical. There are tiny differences. And that's what makes us beautiful. So if I comment on any differences, that's nothing to worry about. It is exactly what we expect. Okay, so go over here and under your eye here, just to check from this spot here to this spot. Okay. That is 6. Okay. Same thing, other side. Right in there. Okay. And that's actually almost exactly the same. So that makes that easy. Now I'm going to go up here. Okay. And that is alright. Beautiful. Now, just gonna double check a couple things here. Get right in here, check that. Under here. Just gonna make a quick note. Cut that, and checked in there. Did we get? Yes, we did. Alright, now a couple more measurements. This area here. It's okay if I just tilt your chin up a little bit. Good. Okay. Well, it's fine. You're doing great. It's just a little easier to get it when it's kind of straight on. So I'm going to get right in here. Sorry to put my hands right in your face, but I gotta check. Okay. Get that one more time. Just gonna... Alright. Other side, same thing. Get right in here and just... Alright, pretty close. Just like that is perfect. Millimeters and 8 millimeters. Okay. Next, I need to measure across your upper lip here. So, once again, getting right in here and just get make sure I'm getting good. Yeah. One more time, just gonna, yeah, that looks right. So, next we're gonna go down the chin, get right in here, and you've got a great chin. You do. I look at faces all day. So you can trust me when I tell you that you got a real nice one. So, good. Right. And 13. Meters. Okay. I'm going to move on to a couple measurements on your neck and just across your upper chest area. Then we'll get a few more facial measurements. So, I'm going to lift your chin up again a little bit. I need to get a measurement here. So I need to be able to get it, but I also don't want you to stretch it too much because that's going to throw off the measurement. So just a little gentle lift of the chin. You can relax a little bit. There we go. Perfect. Okay. So I'm going to get in on this side first and just get a nice, precise measurement. All the way to here. Alright, do that one more time. Just gonna make sure that I've got the curve right. And good. And that is we're going to get to next on the other side. Okay. Again, just really gentle lift the chin. Perfect. Okay. Gonna get right in here. Sorry. Breathing right in your ear. Okay. Let me get this spot here and get down. Good. Okay. If you carry a bag over your shoulder, do you usually carry it on your left side or your right side? Okay. Oh, that makes sense. It makes a big difference in a lot of people's length differential in these measurements here. Again, nothing to worry about, very common. Okay, so let's just check. Yep. Okay. Again, a little bit difference there, but totally normal. Healthy. Good. I'm gonna move down here. 16. Let's fix that. Okay. Now, I'm just gonna be going right across your upper chest here. That's as far down as I'm gonna go, okay? So if you could just, I want to make sure we're relaxed. Could you lift your shoulders up for me? And drop them. Good. Again, lift them up, 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 up. And now, let them relax. Good. Let's do it one more time, please. Up. And relax. Perfect. Okay. Go ahead and get right in here. And have to place it against you right here, clavicle, and that. Okay. And I have to give a very similar measurement just above your clavicle here. So I'm going to get in and that can't be right. It's a little more similar than I was expecting. Check along the bottom here. So I'm just going to press my thumb right here and here. Okay, yeah. I misread that one. But we caught it. So I'm going to go back up here and... Perfect. Okay. That makes more sense. This lower one was 4 millimeters. And the upper one was 7 millimeters. Okay. We're most of the way through. I'm just going to do a quick double check, make sure I went through all the ones that we're supposed to go through in the correct orders. We got up to, and then we have, there it is, that, right? Yes. Got 15, 16. Good. Alright, so we just have, let's see, 1, 2, 3, 6. I think we just have 6 more measurements, 3 on each side of your face. And then I'll let you go. Okay? So, I'm gonna start on the side. So this is gonna be along the side of your face. We've got one here, here, and here. I'm just gonna start right up here and press and down to here. Looks like 1, 4. Same thing on the other side. Okay, I'm going to sneak right in here. Okay. And good. A little lower down on this side, gonna get right in here and pull along. Sorry, I just have to press it a little bit to make sure I'm getting it fitted to the curvature of your face, and that looks good. 20. Same thing, other side. Get right in here. I'm gonna press it. Face right here and look at that. That measurement's almost identical on both sides. Just a couple more. Start on this side again, just kind of along your chin, but up a little bit. Get right in here. And so last couple measurements, let's make sure they are not just perfect, but extra perfect. Alright, nice and even. Very gently. And point one on this one. Okay, and I believe that is all the measurements that we need for this part of the procedure. Are you going to be joining us for the other two phases, I hope? Yeah, can't do a lot with the data if we don't do the other two parts. They're pretty enjoyable and relaxing. Yeah, the next part with the serum is just kind of like a glorified, scientifically based face massage. And then the third part is more of this same thing, just getting all the measurements to see if there are any differences. Yeah, well, I hope to see you there. Let me just go ahead and put this aside. Go ahead and where's the side of the page? Here we go. And what's today's date? Oh, yeah. I feel like it's some famous celebrity's birthday today, isn't it? Look it up later. Okay. And it is o'clock. Thank you for coming in at this time. It's kind of our slow time. It's nice to have someone to work on. And temperature of the room. Degrees. And a couple signatures. Initial. Good. Okay. That's done. So, finally, I don't want to send you home with marker all over your face. Although it looks kind of cute, to be honest. I think you could pull it off. Let me put this over here. And this part's pretty simple. Just got some nice luxury quality cotton rounds. Got some micellar water. I'm just going to soak the cotton pads. And I'm going to do some gentle circles on your face just to rub off all that marker. It should come off pretty easily, okay? So, it's a little cool. It's not cold. I just don't want it to surprise you. Okay. I'm going to start on this side. I'm just going to get in here and good. Just get this spot right back here. Get that right there. Good. Okay, and down here. forehead. Over here. That's mostly when we get your nose and a few down here. Just gonna get right in here, and I'm gonna be gently placing my fingertips on your face just so I'm not stretching out your skin too much. I want to kind of stabilize it. This one's being a little stubborn. Got it. Get your chin here. On this side, get right in, and again gently placing my fingers on your face. Look like your nose, just get a little boop, boop, boop. Alright, well, your face is looking fresh and relaxed and just perfect. So, go ahead and place this aside. Alright, thank you so much for participating. You are an absolute pleasure to work with. On your way out, if you could please stop by scheduling to book your appointment for part 2 of the procedure, and then we'll see you when you come back. All right. Thank you. Bye. Hello. Thank you so much for participating in our study. I know you were probably given a lot of information when you signed on. But before we start, I just want to go over what we're going to be doing. Just the basics, as like a refresher. Okay? Alright. So, we are studying the effects of pre-procedural massage on recovery post-procedure. That basically means that medical procedures can be stressful and traumatic on the body, right? So, we are testing to see if a massage before the procedure might contribute to shorter healing time, better outcomes. What procedure are you having after this? Oh, you are having a Insomnia extraction. Okay. That's perfect. That's a pretty gentle procedure, which makes it perfect for the beginning stages of our study. We're just going to begin with a basic checkup. Just want to make sure you're in good health and there's nothing going on that might preclude doing the procedure today. Then I will administer the massage, and if everything looks good, I'll send you off to your procedure, okay? Alright, let me just... patient session, okay. So, are you comfortable in your medical gown? Is it actually okay if I make a couple little adjustments? Thank you. Okay, let me put this down. Alright, I'm just gonna get right in here, and we just got these new gowns in. It's super soft, isn't it? Yeah, and it's like the perfect weight. I actually snuck one of these home to use as pajamas. I love it. Just gonna readjust the tie here. Maybe from the side. Okay. There we go. a really nice color on you too. Okay, so anything else we need to check off before the exam? Okay, both the initial checkup and the massage, of course, are going to involve me touching you quite a bit. Is that okay? Alright, great. I'm gonna go ahead and grab some sanitizer. I'm gonna put my gloves on and then we'll get started. Okay? Great. So. Okay, so just get those gloves on. Perfect. Okay, so I'm gonna start off by taking your temperature. Let me grab my thermometer. Okay. I'm gonna go ahead and gently place this in your ear. Let's make sure we don't have a fever running or anything. Alright, you're gonna feel me placing it in your ear right here. And okay. Perfect. Looks good. Let's go ahead and do the other side just to make sure. Again, just gently placing it in your ear. Good. Okay. Perfect. Start. Let me go ahead and down, left ear, right ear was almost exactly the same. Okay. So, I'm gonna go ahead and take your pulse. Can I have your hand first? I'm just gonna, thank you. I'm just gonna place my fingers on your wrist. Right here, just a moment. Okay. Good. Write that down. Just for a minute. Let's do the other side, please. Other hand. Thank you. Just gonna count. Good. Perfect. Thank you. Wait for a minute. Feel like a little nervous? Okay. People's heart rate always tends to be just a little bit high during these. Nothing to worry about. It's just, I think, being examined and watched really closely, kind of. You probably don't care, I just think it's interesting. Okay, so I'm gonna do a quick lymphatic check. I'm just gonna be pressing my hand first on this side, then on this side, just making sure there's no swelling. Okay, so I'm gonna place my hand right here. gently palpating. Feels fine. Any illness or allergies recently, or... Okay. Yeah, I think that's fine. Let's go ahead and check the other side. Just gonna place my hand right here. Okay. Feels good. Normal range. No. Swelling. Left. Right. Okay. Just a moment. I need to grab my stethoscope. Okay. So, I'm going to take this right here. I'm going to place it in a few different spots on your chest. I'm going to lower down your gown here. Just going to be listening to your lungs and your heart. Then I'll go around back. I'll check your back. And then we'll move on, okay? So is it okay if I kind of open up your gown a little bit in the front here? Okay, thank you. Perfect, okay. So I'm just going to place this right here. Can you go ahead and take a nice deep breath for me? Just in and out. Perfect. Okay. Just moving it. Another deep breath in and out. Beautiful. One more time. Gonna move it over here and breathe in. Out. Okay, great. I'm gonna go ahead and move around back and check from back there. Alright, just a moment while I loosen up your gown in the back here. Okay, gonna go ahead and place it right here. Alright, can you take a nice deep breath for me? In, out. Beautiful. Okay, just gonna move it over here. Nice deep breath, please. In, out. Good. And right here. Deep breath, please. In, out. Good. Just like that. Thank you. All right. Really happy with that. Go ahead and note. That doesn't look right. Oh. Okay. I'm sorry. I forgot to take your blood pressure. I'm gonna note your clear. Normally front. Normal range. Back. Normal range. Okay. Just a moment. Okay. Where'd it go? Here we go. Okay. I'm sure you've had this done a zillion times in your life. I have a blood pressure cuff here. I'm gonna wrap it around your arm. I'm gonna use my stethoscope to take a little listen to what's going on. And all you have to do is relax. The cuff might be a little firm. It's gonna squeeze on your arm. Please tell me if it feels uncomfortable. it should feel tight, but not so tight that it's uncomfortable or painful. Okay, so just like with everything else, I'm going to do both sides. I'm going to start over here, and then we'll move on to the other side. So, okay, got my blood pressure cuff here. I'm going to go ahead and wrap it around your arm. There we go. Okay, now in a moment I'm going to be inflating it. I'll take a little listen. It's going to be squeezing your arm pretty firmly, but it shouldn't hurt or feel uncomfortable. So please let me know if it does. Okay? Here we go. Okay, and good. Okay, I'm gonna go ahead and remove the cuff. Okay, just like with everything else, we're gonna do both sides. Have you done one of these studies before? Okay, yeah. Now you're a pro at it. You're doing great. Some people get nervous, but you are doing a perfect job. So thank you. You're making this very easy for me. Go ahead and let's wrap it around this arm. Once again, it's going to get a little tight, but it shouldn't hurt. I'm going to go ahead and inflate. Nice. Perfect. Okay, I'm going to go ahead and deflate it. Good. All right, let's take that off. Okay, I'm going to set that aside. I'm not going to need the stethoscope anymore. I'm going to set it over here so it's not swinging all over the place. Just going to do a quick nose and mouth check. I'm just going to gently touch the tip of your nose and lift it up so you can get a good look up each of your nostrils. I'll be real quick. Okay, so I'm just going to place that here. And I'm going to take a look up here. Good. Okay. Other side, just gently lifting up and good. Beautiful. Okay. So let me put this away and grab slightly stronger light for your mouth. Can you go ahead and just let your jaw drop? Yep. Can you open up your mouth, please? Just let your tongue relax and just almost like a yawn, just a beautiful, and just keep it open just like that. I'm gonna take a quick look. Tonsils, your throat, quick peek at your good. Alright. Really nice. Just to open up the back of the throat, can you open your mouth and give me a big yawn, just big, I'm gonna hold your chin, big yawn, big yawn. Good. Alright. Good. Just gonna take a few quick notes, just a moment. And okay. Alright. Alright, we are doing our 4-step eye exam today. Where's that light? Here we go. Okay. So I have this light right here. I'm going to be shining it right in your eyes. I'm going to be giving you some instructions. If you can just follow them as best you can. We're going to start with the... Okay. So I'm going to ask you to hold your head still. Yep, look straight ahead. Just going to adjust you. There we go. Okay. So to begin with, just stare straight ahead. Look at my nose. As best you can, just fix your eye on my nose. Both your eyes. Right here. Good. Okay. Gonna bring this up. Good. Okay. So now, I'm going to bring the light up, and I'm going to be moving it around a little bit. If you can do your best, just follow the light. Okay. So, look at the light. Perfect, just like that. Okay. I'm going to be moving the light without moving your head. Just going to stabilize your face a little bit here. Okay. So without moving your head, just follow it with your eyes. Good. Yeah, just like that. Follow it. Good. Okay. Up. Down. Beautiful. Yes. Good. Okay. Back over here. Blink if you need to. Okay. Following the light. Good. Beautiful. Okay. A couple quick notes. Within normal range. Okay. Now, I'm going to hold the light up. Back here. Can you go ahead and look at the light, please? Yeah. Just fix your eyes right here on the light. There we go. Now I'm going to be moving the light toward you. Do your best to keep your eyes on the light. Keep your eyes on the light. Follow, follow, follow. Good. And keep your eyes on the light as it goes out. Blink if you need to, but keep your eyes on the light. Back in, and good. A+. Okay. So, okay. Accommodation reflex is... Okay. Next, I'm going to have you pick a point in the distance on each side. I'm going to be shining this light in your eye just obliquely. Why don't we go ahead and start with your left eye? Can you just pick a point back there? Any point, it doesn't matter. Keep your eyes fixed on it. I'm going to be bringing the light in. I'm going to be shining it in your eye. Do your best not to look at the light, to keep your eyes fixed on that spot back there, okay? Alright, so eyes back there. Good. Okay, I'm going to bring the light in. I'm just going to take a look. Okay. Keep your eyes on that spot back there. Blink if you need to, but then bring your eyes back to that one spot. Okay, it's going to be a little closer this time. Keep your eyes back there. I'm just gonna... Good. Okay. Beautiful. Left eye in. Other side, you pick a point back here on this side. Good. You're a pro at this now. Look back here. I'm just gonna bring the light in. Keep your eyes back there. Don't look at the light. I'm just gonna... Good. Blink if you need to. It's gonna be a little closer this time. Okay. Right up in there. Just keep your eyes fixed on that spot behind me. Good. One more, looking back here. Beautiful. Observation is now, once again, I'll close your eyes for a moment. Open them. Good. Okay. So once again, I'm going to ask you to look at my nose. I'm going to be shining the light and moving it kind of back and forth. Okay, I'm just going to be doing our sweet flashlight test right here. Okay, so your eyes are going to be right here. Don't move your head. Don't move your eyes. Blink if you need to, but then open them right back up. Look at my nose. I'm just going to bring the light. Good. Keep looking right here. Don't look at the light. Good. Okay, right here. Good. Okay, we're going to do that again. I'm going to have the light much closer to your face this time. Just right here, okay? So looking right here, I'm just going to bring it in. And in. Good. Looking right here. Beautiful. Okay. Your pupils are on top of it. Do you exercise them? Okay. Now, and point. Now, I'm going to do a quick ear exam. I'm going to grab my otoscope. Okay. So I just need to do a quick check of your ears and your hearing. Have you been having any issues recently with difficulty hearing in either ear or pain in either ear? Okay. Yeah. So, it doesn't have to be perfect. We just have your previous medical history here, and we're just testing for any changes. Okay. So, I'm going to go ahead and place this in your ear. Going to take a little look around. Then go ahead and move around to the side, take a look, take some notes, and do a quick hearing test. And then you'll be done with this. You can move on to the massage. Okay, so while I'm doing the ear exam, can you go ahead and look straight ahead? Okay, I'm going to sort of stabilize your chin with my hand, if that's okay. Okay, thank you. So I'm just going to move over here. I'm going to gently hold your chin right here. This shouldn't feel uncomfortable. Please let me know if it is. I'm going to go ahead and place the otoscope in your ear right here. Okay. Just going to take a good look around. Checking the ear canals ready. Signs of irritation or infection, any scrapes, swelling. Looking really good. No excessive cerumen or anything else. Gonna go a little deeper here. Good. Take a good look at your tympanic membrane, your eardrum. Gonna make sure it's the right amount of translucent. No sign of fluid buildup or anything else.
Hopefully they should. Good. Okay, I'm gonna go ahead and remove the otoscope.
Good. You'll be pleased to know that your left ear, at least, is the absolute picture of tympanic membrane health. Let's get the other ear real quick. Once again, placing the otoscope in your ear. Good. Alright. And we're looking really good over here as well. Let's see. Here we go. Looking healthy. A little bit of earwax, but totally healthy, normal amount, so that's good. Not seeing any rabbits or swelling or anything to be concerned about. Gonna get in a little deeper here. Good, okay. And we've got another beautiful tympanic membrane. Perfectly translucent. Not seeing any signs of infection or fluid buildup. Everything looks really, really good. Okay. Removing the otoscope. Good. Okay. I'm gonna go ahead and put this away real quick. Beautiful. Next, we're gonna do a very basic, simple hearing test. I'm gonna take my hands and I'm going to be doing this very close to your ear. What I'm going to do is I'm going to do this, I'm going to slowly move it away. If you could just say something or signal to me when you can't hear it anymore, okay? So if you can hear it, just chill. Once you can no longer hear it, just say no, raise a finger, give me a little wink, whatever you want, okay? So, just going to let me know when you can no longer hear it. Good. Okay. Same thing, other side. Let me know. Okay. Beautiful. So that's about... Yeah, that's plenty. Okay. Good. All right. You did a great job. That's it for the exam. I'm really happy with how everything looks. Are you feeling good? You good with moving on to the massage now and then the procedure afterwards? Okay, great. So I'm going to go ahead and sign off on your massage. Gonna sign off on the procedure. There we go. I think there's one more in here. There we go. Beautiful. I'm going to go ahead and set this aside. All right. So I'm pleased to inform you that you're in good health, you're in perfect shape for the procedures. I'm going to go ahead, I'm going to do your massage, and then we'll send you on your way. Okay? So it's going to be pretty basic. I'm going to go ahead and move behind you. I'm going to loosen up your gown in the back, kind of open it up. As you probably notice, it's designed to hang open in the back while still keeping you covered in the front. Please feel free to adjust it, shift it around as is comfortable, lower it, raise it, whatever is fine. I'm just going to be getting in there and doing a moderate pressure massage on your shoulders, your back, and once we've gotten through that, you'll go ahead and move on to your extraction, okay? Alright, great. You can just sit there and get comfortable, and I'll go ahead and move around. We'll get started with that massage. Alright, let me grab some massage oil. We have a few different types here. They're all natural, hypoallergenic, very safe. They absorb really nicely into the skin, so this is going to help my fingers glide really nicely over your shoulders and your back, especially with the gloves on, but it'll absorb in really nicely. You don't have to worry about feeling greasy or anything like that. So I have some plain unscented oil, and I have this one here, which is lavender scented. I have one that is vanilla scented. I have another one over here, and the scent is exotic musk. It's like a sort of rich, musky smell. They're all really nice. None of the scented ones are too strong. Which one would you like? The unscented, the lavender, the vanilla, or the musk? Alright, you got it. So, first let me go ahead and open up your gown in the back here. Perfect. You feeling a little breeze on your back? Okay. Don't worry, okay. You're nice and warmed up with my hands. Let's go ahead and grab some oil. Okay. Now this is going to be a pretty gentle, medium pressure massage. I'm going to begin by just sort of gliding my hands the back of your neck and your shoulders here. Just smoothing the oil onto your skin. Giving your body a chance to get comfortable with my touch. Let's get back your neck here. Gonna grab a little more oil to spread over your upper back here. Gonna feel some nice long strokes going down your back. First on this side. Here we go. And on the left. Good. Beautiful. I can already feel your muscles relaxing beneath my touch. That's great. Okay. I'm going to get back up to your shoulders here and using mostly pressure from my fingertips. Just going to start gently working the muscles on both sides. Starting with fairly light pressure and then a little deeper. Good. Okay. How's that feeling? You're looking nice and relaxed. Let's get the back of your neck here. Mostly using pressure from my thumbs. Nice long strokes at the back of your neck here. Some little circles. Okay. I'm gonna get all my fingers in on it here. Using my thumbs to kind of work this area at the base of your skull here. And if you want to do any kind of visualization to help along the relaxation process, you're welcome to. Just imagine the muscles of your neck, your shoulders, your back feeling warm, relaxed, soft and cozy beneath my touch. Okay. A little more oil here. Gonna start doing some nice long strokes down your back here, starting on the right. And on the left. Down your back. Nice. Smooth massage strokes. Making your muscles warm and relaxed. in circles as I work my way down. Here we go. How's that pressure? Is it too firm or is it just right? Okay, noted. Here we go. Working my way down. More nice long strokes down the right side here. And on the left. Beautiful. You're already so much more relaxed than when we started. You're very receptive to massage. That's great. More little circles with my thumb here. Working my way down. Okay, I'm going to place my hands on your shoulders, both sides, here and here. Okay. I'm going to gently squeeze your shoulders like that. Squeeze and release. Again, I'm going to squeeze and release. Squeeze. Good. Let's give a little more attention to your left shoulder here. Gonna really get in there. Get some of that on the right shoulder. Responding so nicely to this. Okay. A little more attention to the back of the neck here. Firm little circles with my fingertips. Circles and strokes. Working out any remaining tension. Good. Really nice. Okay. Let's go down your back. back again, first on the left. Good. On the right. Okay. Gonna place my hands on your shoulders again here. Gonna do a few more squeezes. I'm gonna squeeze, release, squeeze, 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 release. One more time. I'm gonna squeeze and release. Okay. Now, I think you're in pretty good shape. You're looking so much more relaxed. I think I can do a little bit more, get you a little more relaxed before your procedure. So let's give a little more attention to your left shoulder. And on the right. A few more gentle strokes down your back, first on the right. Little circles. Good. On the left. Beautiful. Okay. Well, I think you're ready. Okay. I'm gonna go ahead and get your gown tied back up here. Okay, there we go. You have been an absolutely perfect patient for this study so far. Thank you. I'm going to go ahead and sign off on your procedure, and we'll send you on your way to your insomnia extraction. I think it's going to be a great success for you. All right, let's go.